What if 14 days could be the difference between a heart attack and a lifetime of cardiovascular health? What if the swelling in your ankles right now is sending you a warning signal that could save your life? And what if a simple supplement protocol could reverse years of silent inflammation faster than anyone thought possible? Today, we're diving into a case that left one of America's most respected longevity physicians completely stunned. A transformation so dramatic it challenges everything we thought we knew about inflammation recovery time. The statistics are staggering. Over 655,000 Americans die from heart disease every year, making it the leading cause of death in the United States. But here's what most people don't know. The warning signs often appear in the most unexpected places: your ankles, your wrists, even your fingers. Chronic inflammation doesn't just happen overnight, and it doesn't just affect one part of your body. It's a whole-body phenomenon that starts silently, progresses relentlessly, and often goes completely undetected until it's too late. Dr. Peter Attia, the renowned physician whose work in longevity medicine has revolutionized how we approach preventive health, encountered a patient whose case would challenge even his extensive experience. This wasn't just another success story. This was a medical puzzle that would reveal something profound about the human body's capacity for rapid healing when given the right tools. The patient, a 52-year-old software engineer from Silicon Valley, walked into Dr. Attia's clinic with what appeared to be routine complaints. He was experiencing persistent swelling in his ankles, occasional shortness of breath during mild exercise, and that vague sense of fatigue that so many middle-aged Americans dismiss as just getting older. His primary care physician had suggested losing weight and cutting back on salt. Standard advice for standard symptoms. But Dr. Attia saw something different. What makes this case extraordinary isn't just the rapid improvement. It's what those ankle numbers revealed about a hidden epidemic affecting millions of Americans. Research from the American Heart Association shows that nearly half of all adults in the United States have some form of cardiovascular disease, but the vast majority don't know it. The inflammation that precedes heart attacks, strokes, and other cardiovascular events can be brewing for years, even decades, before the first obvious symptoms appear. When Dr. Attia ran comprehensive inflammatory markers on this patient, the numbers told a frightening story. C-reactive protein levels were elevated at 8.2 milligrams per liter, nearly 3 times higher than what's considered safe. But more concerning were the peripheral inflammation markers, specifically those measured in the ankle and lower extremity circulation. These numbers, which Dr. Attia has pioneered in using for cardiovascular risk assessment, were in the danger zone. The ankle brachial index, a measurement that compares blood pressure in the ankle to blood pressure in the arm, revealed significant peripheral arterial compromise. But it was the inflammatory burden in the microcirculation of the lower extremities that painted the most alarming picture. Specialized tests measuring inflammatory cytokines, oxidative stress markers, and endothelial function in the ankle region showed levels consistent with active cardiovascular disease progression. This is where Dr. Attia's approach diverges dramatically from conventional medicine. Instead of simply prescribing anti-inflammatory medications or waiting for symptoms to worsen, he developed a precision supplement protocol based on the latest research in nutritional biochemistry and inflammation science. This wasn't guesswork. Every component was selected based on peer-reviewed studies showing measurable effects on specific inflammatory pathways. The protocol centered around what Dr. Attia calls intelligent supplementation, targeted nutrients that work synergistically to address inflammation at the cellular level. The foundation was high-dose omega-3 fatty acids, but not just any omega-3s. These were molecularly distilled, pharmaceutical-grade EPA and DHA in ratios specifically designed to maximize anti-inflammatory effects. The dosage was precisely calculated based on the patient's body weight, baseline inflammatory markers, and genetic factors that affect omega-3 metabolism. But omega-3s were just the beginning. The protocol included curcumin with enhanced bioavailability, delivered in a form that could actually reach therapeutic levels in the bloodstream. Most curcumin supplements are poorly absorbed, but this formulation used specialized delivery systems that increase absorption by up to 2,000%. The anti-inflammatory effects of curcumin rival those of prescription NSAIDs, but without the cardiovascular risks. The third crucial component was a combination of antioxidants specifically chosen for their effects on vascular inflammation. This included resveratrol, but in a form stabilized for maximum bioavailability, plus quercetin and pterostilbene, compounds that work synergistically to protect blood vessel walls from inflammatory damage. The dosages were far higher than typical supplement recommendations, calibrated to achieve therapeutic blood levels based on pharmacokinetic studies. Perhaps most importantly, the protocol included nutrients that specifically support endothelial function, the health of the inner lining of blood vessels. L-arginine and L-citrulline were included to support nitric oxide production, essential for healthy blood flow and vascular flexibility. Magnesium glycinate was added not just for its direct anti-inflammatory effects, but for its role in over 300 enzymatic reactions that affect cardiovascular health. The patient followed the protocol religiously. Every morning, he took his precisely timed supplements with specific foods to maximize absorption. He tracked his compliance meticulously, understanding that consistency would be crucial for seeing results. But even Dr. Attia was skeptical about how quickly changes might be measurable. Inflammation is notorious for being slow to respond, and conventional wisdom suggested that significant improvements would take months, not weeks. Day 7 brought the first hints that something remarkable was happening. The patient reported that his ankles looked less swollen, and his energy levels were noticeably improved. But subjective improvements can be misleading, and Dr. Attia cautioned against reading too much into early changes. The real test would come with objective measurements. On day 14, the patient returned for follow-up testing. Dr. Attia ran the same comprehensive panel of inflammatory markers, expecting to see modest improvements at best. What he found instead challenged his understanding of how quickly the human body could respond to targeted nutritional intervention. The C-reactive protein levels had dropped from 8.2 mg per liter to 2.1 mg per liter, a 75% reduction in just 2 weeks. But even more striking were the peripheral inflammation markers. The ankle-specific measurements showed improvements that typically take months to achieve with pharmaceutical interventions. Inflammatory cytokines in the lower extremity circulation had normalized, oxidative stress markers were dramatically reduced, and endothelial function tests showed remarkable improvement. Dr. Attia double-checked the results, thinking there might have been a laboratory error. He had the tests rerun at a different facility. The results were consistent. In 14 days, this patient had achieved inflammatory improvements that rivaled what Dr. Attia typically saw after 6 months of conventional treatment. But the most shocking discovery came when Dr. Attia compared these results to his database of similar patients. This wasn't an isolated case of exceptional response. When the same protocol was applied to other patients with elevated inflammatory markers, similar dramatic improvements were consistently observed. The data suggested that the right combination of nutrients, at therapeutic dosages, could reverse inflammatory damage far more rapidly than anyone had imagined. This case reveals something profound about the untapped potential of precision nutrition in treating inflammation. For decades, we've underestimated the power of targeted supplementation, partly because most studies use inadequate dosages or poorly absorbed forms of nutrients. When therapeutic levels are actually achieved in the bloodstream, the anti-inflammatory effects can be as powerful as prescription medications, but without the side effects. The implications extend far beyond this single patient. Millions of Americans are walking around with chronic inflammation that's silently damaging their cardiovascular systems. Many have ankle swelling, fatigue, or other subtle symptoms that get dismissed or attributed to aging. But as this case demonstrates, these could be early warning signs of serious cardiovascular risk, and they might be far more reversible than we ever thought possible. What makes this discovery particularly significant is its accessibility. Unlike experimental treatments or expensive procedures, the supplements used in this protocol are readily available. The challenge lies not in obtaining them, but in understanding the precise formulations, dosages, and timing needed to achieve therapeutic effects. This is where precision medicine becomes crucial. What works for one person may not work for another, depending on genetic factors, baseline health status, and individual inflammatory patterns. The key lesson from this case is that inflammation isn't necessarily a life sentence. With the right approach, even years of accumulated inflammatory damage can begin to reverse remarkably quickly. But timing matters. The earlier intervention begins, the more dramatic the potential for recovery. Waiting until symptoms become severe, until the chest pain starts, until the first heart attack occurs, means missing the window when simple, safe interventions could be most effective. For anyone concerned about their cardiovascular risk, this case offers both hope and a clear call to action. Those ankle symptoms you've been ignoring, that persistent fatigue you attribute to stress, the subtle changes in your exercise tolerance, these could be your body's early warning system. Getting proper inflammatory marker testing isn't just about curiosity, it could literally save your life. The future of cardiovascular disease prevention lies not in waiting for symptoms to appear, but in detecting and reversing inflammatory processes while they're still silent and reversible. Dr. Attia's patient didn't just improve his ankle numbers, he potentially added years, even decades, to his healthy lifespan. In just 14 days, he went from the path toward cardiovascular disease to the path toward optimal health. This is the promise of precision medicine, not just treating disease, but preventing it by addressing root causes before they become irreversible. The question isn't whether your body can heal, it's whether you'll give it the tools it needs to do so.